Welcome back, everybody, to the deep dive. This time, we're going to dig into February marketing in home health, hospice, and private duty care.
Yeah, and the source material we've got for this deep dive is really cool, actually. It's kind of set up like a calendar full of all these different prompts.
Almost like they mapped out the whole month with, special weeks and events,
Yeah.
things like National Wear Red Day, even Valentine's Day.
Yeah. It gets really specific, which is interesting. It's not just, general marketing tips. This is like
It's like
up-
hyper-targeted.
really targeted stuff for a very specific time of year. They even found a way to tie in National Bubblegum Day somehow.
No kidding.
Yeah.
But before we get to all the fun stuff,
Yeah.
can you talk about why this kind of targeted marketing can be so valuable?
Well, I think the big thing is that you're really leveraging these awareness campaigns that are already out there. Things that are happening in the community conversations that people are already having.
So you're not starting from scratch.
Right. You're sort of plugging into something that people are already paying attention to, which makes your message more timely, more relevant, more likely to be heard.
So let's jump into the month, and we'll follow this document week by week. Week 5 is all about hearts, National Wear Red Day, and American Heart Month. And they've got some of the classic ideas like writing a letter to the editor about heart health and mentioning your agency as a resource.
I was going to say that's a good one. Getting that letter to the editor, again, positioning yourself as a thought leader.
Right, expert.
An expert, right?
Yeah.
Not just someone who's selling a service, but they also have some more like visual tactics too.
Yeah, partnering with a cardiologist for a class. Handing out heart stickers at assisted living facilities.
Heart stickers.
I know. Seems a little cheesy, but I bet people remember that.
Oh, absolutely. I mean, think about it. It's low cost, it's memorable, it's tapping into all those positive emotions.
It's hard not to smile at a heart sticker.
Exactly. So you're creating this immediate positive association with your brand.
And then they suggest hosting a forum for women to share their own stories about heart disease.
Oh, that's a good one because that goes beyond, just the basic information and gets into that emotional side of things. And storytelling, we've talked about this before, storytelling is so powerful, especially when it comes to health. When you can hear people share their own experiences, it just builds trust. It builds a sense of community.
All right, on to week 6, and get ready for a Valentine's Day blitz. This document really encourages agencies to embrace the whole Valentine's Day spirit. Staff wearing red, sending Valentine's e-cards to referral sources. They even suggest partnering with a florist to hand out carnations.
You might think that's a little superficial, but there's a real psychological principle at play here. By associating your brand with a positive holiday like Valentine's Day, you're tapping into all those existing emotions and memories. It's subtle, but powerful.
So it's almost like you're borrowing a bit of that Valentine's Day warmth and goodwill for your agency.
That's right,
And,
yeah.
and then there's this really kind of poignant idea for private duty agencies. Sending Valentine's Day cards to spouses of deceased clients.
Yeah, that one's a little bit more delicate. Obviously, you want to make sure it's done with genuine sensitivity. But think about the impact of receiving a card like that. It shows you're not just a business, you're thinking about people's lives even beyond that immediate service.
You're letting them know you're still thinking about them.
Yeah, that you care even after their loved one is gone.
So we move on to week 7. We shift gears to National AMD Low Vision Awareness Month. The document suggests partnering with optometrists, creating specialized flyers about your services for people with low vision, even donating low vision bingo cards to facilities.
I like that there because we're talking about niche marketing. You're recognizing that not all seniors have the same needs, and by tailoring your messaging, you can really become that go-to expert for a specific part of the population.
They also recommend that private duty agencies offer a 3-hour meal prep and safety supervision package specifically for patients who are recovering from eye procedures and have that temporary vision impairment.
Oh, that's great. Again, you're identifying a specific need and creating a service to meet it. It shows a deep understanding of the challenges, someone might be facing after a procedure like that. And again, you're positioning yourself as a problem solver.
And then we wrap up the month with week 8, which coincides with Wise Healthcare Consumer Month. And this whole section really focuses on education. Monthly newsletters, diet and nutrition classes, senior exercise classes, health screenings. It's about making yourself a resource for the community.
Absolutely. By providing this valuable information, you're building trust, you're establishing yourself as an expert, People are more likely to turn to someone they see as knowledgeable and helpful when they need care for themselves or a loved one.
And one of the things they suggest is partnering with a doctor's office and doing a class together on getting the most out of a doctor's visit.
Oh, that's smart. It's so practical, it's timely, it's beneficial for both parties. The doctor's office gets to offer this great information to their patients, and you get to connect with potential clients and referral sources in a setting where they're already thinking about healthcare.
Makes sense. Now, this document isn't just about all these, fun weekly themes. It also sort of introduces a bigger, more strategic framework.
This is where it gets interesting because it goes beyond, individual tactics and into more of a marketing philosophy. They call it a three-tiered approach. And it's really something you can apply year-round, not just in February.
Yeah, they lay it out as a pyramid.
Yeah.
Level 1 is your direct referrals, those existing contacts you already have. Level 2 is network groups, other businesses that serve seniors. And then level 3 is the broader community.
And it's recognizing that, marketing isn't just about shouting your message into the void. It's about building relationships, collaborating, expanding your reach strategically.
And one of the ideas they have to illustrate this is they call it a senior seminar, where you get all these different senior service providers to come together for a day of presentations and information.
Oh, wow.
It's like a one-stop shop for seniors and their families, to learn about all the resources that are available in the community. So you could have, a home health agency, a private duty agency, a DME company, a financial advisor specializing in elder care, all in one place.
That's fantastic, but logistically.
Yeah, I was going to say, it sounds great, but I imagine there are some challenges.
Yeah, I mean, you'd really have to think about things like venue selection, speaker coordination. How do you get everyone on the same page with the marketing? It's a big undertaking.
But could be really powerful if you could pull it off.
Definitely. When it's done well, it's an incredibly effective way to raise awareness and build those all-important relationships.
All right, let's shift gears now and talk about some of the specific advice they give for hospice agencies. And they really stress the importance of education and making sure people understand the qualifications for hospice care.
That's so important because hospice is one of those things that's often misunderstood. People might think it's only for the last few days of life or that it's only for cancer patients.
So it's about dispelling those myths and making sure people have accurate information.
Exactly. And it's especially important to reach those clinicians, those referral sources who are making decisions about patient care.
They actually have 3 key questions that say you should ask yourself when you're looking at your hospice marketing materials.
Oh, that's a great idea.
Yeah, and it's all about making sure that your materials are actually informative and relevant to the needs of those clinical professionals.
So it's not just about promoting your services.
Right.
It's about giving them what they need to make those decisions about their patients.
So the first question is it details from a clinician's perspective? So not just general information about hospice, but details that would be relevant to a doctor or a nurse.
Exactly. And then number 2 is, does it cover all the end-stage disease qualifiers for Medicare?
So you're being really clear about who's eligible.
Exactly. And then finally, does it include things like functional assessment criteria? So going beyond just the diagnosis and looking at the patient's overall, abilities, which can be such a key factor in determining if they're eligible for hospice.
So by answering those 3 questions, you're making sure that your materials are seen as valuable resources by clinicians and that you're positioning yourself as a true partner in that patient's care. All right, let's wrap up this section with a quick look at private duty care. The document's big tip here is to focus on specialized caregiver skills as your unique selling proposition.
This is so important in such a competitive market. You have to differentiate yourself. If your caregivers have specialized training, whether it's dementia care, Parkinson's care, end-of-life care, that's something you want to shout from the rooftops.
Absolutely, and they have this really interesting example. They suggest partnering with a hospice agency and having them train your aides in end-of-life care.
Oh, that's fantastic.
I thought that was a really clever idea.
Yeah, you're expanding your service offerings, you're building a strategic alliance.
The private duty agency gets a new skill set. The hospice agency benefits from having more caregivers who are trained in end-of-life care.
It's win-win.
It really is.
And it shows that you're committed to, providing the highest quality of care.
Wow, we've covered a lot of ground. From heart stickers to hospice education, this document is full of ideas. What's standing out to you? What's got you thinking?
Well, I think what's really interesting is how much emphasis there is on those personal connections, whether it's partnering with other organizations, offering these educational classes, or even just sending a heartfelt card. It's about being more than just a business.
That's a really good point. It's about building those genuine relationships.
Exactly. And that can make all the difference in the world.
But how do you translate that into action? I think that's what we need to dig into next. How do you take these ideas and actually make them a reality?
Let's do it.
We just went through a whole month's worth of marketing ideas and prompts, and I don't know about you, but I'm feeling inspired.
Yeah, me too. But, ideas are only as good as their execution, right?
That's what they say.
You got to take those creative sparks and turn them into action. And I think this document does a pretty good job of outlining some actionable steps.
Yeah, one thing that really jumped out at me was the focus on educational content. Almost every week, there's some kind of class or seminar or workshop.
It's a good strategy. You're not just promoting your services, you're positioning yourself as that trusted source of information.
Yeah, like doing Wise Healthcare Consumer Month, they talk about offering classes on diet and nutrition for seniors, exercise,
Yeah.
even how to get the most out of a doctor's visit.
Right. You're providing real value there. You're helping people navigate the complexities of aging and healthcare.
It's about building those relationships before someone even needs your services.
Exactly. And by partnering with other organizations like doctors' offices or senior centers, you can really tap into those existing networks.
And reach a wider audience.
Exactly.
I was also intrigued by the idea of publishing a monthly newsletter. It seems almost old-fashioned in this digital age, but I can see how it could be effective.
Oh, totally. A well-crafted newsletter can really help you stay top of mind with those potential clients and referral sources. You can share valuable information, highlight your expertise, showcase the human side of your agency with, stories or testimonials.
It's a way to build that long-term relationship. It's not just a sales pitch.
Exactly. And speaking of relationships, this document really emphasizes collaboration, which brings us back to that senior seminar idea.
I love that idea. I just keep picturing, you walk into a big room and there's all these booths set up for different senior services, home health, private duty, medical equipment, financial planning. It's like a one-stop shop for seniors and their families.
Oh, absolutely, like a resource fair.
Yeah.
But like you said earlier, there's definitely some logistical challenges to think about.
Where do you even begin with something like that?
Well, first you got to identify those potential partners, right?
Okay.
Think about businesses that complement your services, share your target market. Then you start those conversations early. What are our shared goals? What resources can each partner bring to the table? How are we going to handle things like marketing and logistics?
I would imagine there's some cost savings there, too, if you're splitting those expenses, for a venue or marketing materials or food and drinks with 5 or 6 other organizations.
Oh, absolutely. And you're also sharing the workload, which can be huge, especially for smaller agencies with limited staff.
So collaboration is really a key theme here, not just for the senior seminar, but for a lot of the weekly ideas as well. Like for National Wear Red Day, they suggest partnering with a cardiologist to offer a free heart health class at an assisted living facility.
Perfect example. You're combining your expertise with the cardiologist's specialized knowledge to provide something truly valuable.
And it gets you into that assisted living facility, which is a key referral source for a lot of home health agencies.
You're building relationships, you're raising awareness, you're potentially generating leads, all in one fell swoop.
All right, let's talk about Valentine's Day. Some of those suggestions seem pretty straightforward, like, staff wearing red or sending out e-cards. But what about sending Valentine's Day cards to spouses of deceased clients? How do you approach that sensitively?
The key there is to be genuine. It can't be a sales pitch disguised as a sympathy message. It has to be, a sincere expression of caring and remembrance.
So maybe something simple like thinking of you and deceased client's name this Valentine's Day.
Exactly. It's a small gesture, but it can have a huge impact. It shows that you see your clients as people, not just case files.
That you're there for them even after their loved one is gone.
Exactly.
So let's move on to National AMD Low Vision Awareness Month. One of the things they talk about in the document is offering specialized services for seniors with vision impairments.
Yeah, they even suggest that private duty agencies have a specific package that includes, meal prep and safety supervision for people who've just had eye procedures and have that temporary vision loss.
It's smart. It addresses such a specific need. It's not just saying, we can help with errands and housework. It's like, we get it. We understand what you're going through, and we have a service just for you.
You're a problem solver.
Exactly.
And that's a powerful marketing message.
Totally.
Yeah.
And it opens the door for, conversations with ophthalmologists and optometrists.
Who can be great referral sources.
Absolutely. So I think niche marketing is a big takeaway here. It's about recognizing those unmet needs and tailoring your services and your messaging to meet them.
Exactly.
Okay, let's talk about some of the specific tactics for hospice agencies. This document really emphasizes educating referral sources about, who qualifies for hospice care.
Again, super important because there's a lot of misinformation out there. Some people think hospice is only for the last few days of life, or that it's only for people with cancer.
Right, so it's about dispelling those myths and, providing clear information.
Yes, and they suggest a really good approach, create marketing materials that answer the questions clinicians are most likely to have.
And they actually list 3 key questions to consider. The first one is it detailed from a clinician's perspective?
Right, so think about what a doctor or nurse needs to know to make a referral. They don't want, general information about hospice. They want specifics.
They want details about eligibility, coverage, services.
Exactly. The second question is, does it cover all the end-stage disease qualifiers for Medicare?
So being very clear about who qualifies.
Yes. And the third question is, does it include things like functional assessment criteria? So again, going beyond just the diagnosis and looking at the patient's overall, abilities.
Because that can be a really important factor in determining if someone is eligible for hospice.
Exactly. So by addressing those 3 questions, you're really giving clinicians the tools they need to make informed decisions about their patients.
You're becoming that trusted resource.
Exactly.
And finally, for private duty agencies, the document recommends highlighting specialized caregiver skills.
Which is so important. In a crowded market, you have to set yourself apart. And if your caregivers have special training in areas like dementia care or Parkinson's care, shout it from the rooftops.
And they had that great example of partnering with a hospice agency to train aides in end-of-life care.
Such a smart idea.
It benefits everyone involved.
Everyone, the private duty agency, the hospice agency, and most importantly, the patients and families.
So it's about thinking beyond the traditional marketing playbook.
And finding those creative ways to connect.
I love it. So we've talked about weekly themes, that 3-tiered marketing strategy, specific tips for hospice and private duty agencies. What are you finding most interesting or relevant in all of this?
What really resonates with me is this idea of building genuine connections with the community. Whether it's partnering with other organizations, offering those educational classes, even just sending a heartfelt card. It's about being more than just a business.
It's about building relationships.
Absolutely. And showing that you care.
But how do we take these ideas and make them a reality? That's what I'm curious about.
Yeah, let's talk about that. How do we turn inspiration into action?
So we've gone through all these great ideas, from heart stickers to, sophisticated partnerships. But I think the hardest part is figuring out how to actually put it all into practice.
Yeah, it's easy to get excited about, creative ideas, but actually implementing them, that's where the rubber meets the road.
Exactly. So let's talk about that process. If you're a home health agency, hospice, private duty, whatever, and you're listening to this, what are the next steps after you finish this deep dive?
Well, I think first you have to go back to that source material and think about, your specific goals. Who are you trying to reach? What are your biggest challenges? Not every idea is going to be the right fit for every agency.
It's like clothes shopping, right?
Yeah,
Some things look great on the rack, but they just don't work for you.
totally. You have to find what fits your style, your needs, your budget.
Okay, so let's say you're really drawn to that heart health forum for women that we talked about, during American Heart Month. How do you actually make that happen? What are the steps?
All right, so let's break it down. You need a venue, right? Is there a community center that would be a good fit? A senior living facility that might partner with you?
And then you meet speakers.
Exactly. Who are you going to invite? A local cardiologist? Maybe a nutritionist? Someone who can share their own personal story about heart disease.
And then you have to promote it. Flyers, social media, emails to your referral sources.
Don't forget about the logistics, too.
Yeah.
What kind of refreshments are you going to have? Do people need to register in advance? All those little details can really make a difference.
They can make or break an event, for sure.
Yeah.
What about those partnership ideas that we talked about? Like connecting with optometrists for AMD Awareness Month, or, private duty agencies training their aides in end-of-life care. How do you even get started with something like that?
Relationships. You have to build relationships. So think about the organizations in your community that align with your goals or your target market, and just reach out. Start a conversation. See if there's a way you can work together.
It's almost like dating. You're looking for a good match. someone who complements your strengths and brings something new to the table.
I love that analogy. And just like dating, it takes time and effort to build a strong partnership. You can't just, show up and expect everything to fall into place.
It's a process.
It is.
So how does that three-tiered marketing approach that we talked about fit into all of this?
Sure.
How can agencies start using that?
Okay, so start by mapping out your existing network. Who are your most consistent referral sources? What other businesses or organizations are serving the same population? That's your level 1 and 2. And then you think about how you can expand outwards to reach that level 3, the broader community.
So the senior seminar is a good example of that, right? Bringing all these different providers together.
Exactly. And remember, marketing isn't a one-time thing. It's an ongoing process. It's about showing up consistently, engaging with your community, providing value.
So it's not just about February. It's about building those long-term relationships all year round.
Couldn't have said it better myself.
Well, I think this deep dive has given us a lot to think about. It's a roadmap, not just for marketing in February, but for really approaching home health marketing in a more creative and strategic way.
Absolutely. And I think the key takeaway is that, you have to go beyond those traditional marketing tactics. Find ways to connect with people on a more genuine level, and don't be afraid to get creative.
So to all of our listeners out there, we'll leave you with this question to ponder. If you could pick just one of those February marketing ideas that we talked about, which one would have the biggest impact in your community?
And why? What's unique about your market that would make that idea a success? We'd love to hear your thoughts.
Thanks for joining us on this deep dive into the world of home health marketing. Until next time, stay curious.